welcome to our workshop. This is part 2 of a 2-part series I did. Last month I did allergies and asthma. Thank you. And then today I'm doing autism and ADHD. I picked those 4 things because 1 out of 3 children in America have one of those 4 conditions, and sometimes they have more than one of those 4. So it's definitely a concern in our country with so many children being sick and diagnosed with these things. So I wanted to cover different things that we could do as parents and as a chiropractor to help these children and to not overly diagnose and overly prescribe medication. So, here we go. Autism is a group of developmental disabilities that can cause significant social, communication, and behavioral challenges. 1 in 68 children is diagnosed with autism, and it does favor boys. They actually recently said that it's probably closer to 1 in 45 right now, that the 1 in 68 is probably a little bit off. So it's probably even more than that. And recent research shows that by 2025, it can be as many as 1 out of 2 children, which is just crazy to think about. Autism is diagnosed based on behavioral criteria out of the DSM-4, which I think is actually the 5 now. Unfortunately, a neurological disorder is being diagnosed based on a list of symptoms. So rather than searching the brain or searching the body for commonalities among these children, they're listing out symptoms and they're diagnosing based on that, rather than trying to figure out what do they all have in common and how do we work to correct these physiological components of autism or ADHD. All right, here is a chart of the prevalence, and you can see that in 2000, that the prevalence was about 1 in 150. That was only 16 years ago, and now in just a short time, we're all the way up to 1 in 45. And it does favor boys more often, like I said. So you can see there's a radical, drastic increase in prevalence in just the last 15 years. So why are we seeing these increases? Why, what is causing, what in our environment, what in our genes is causing this increase? A lot of people want to say that it's that medical doctors say that we're diagnosing it better now. We're finding it earlier and we're diagnosing it better, so that's why we're seeing this increase. While that might be part of it, that might be part of why we're seeing more cases now, that doesn't explain that big of a jump. It can't. It just statistically can't explain. And then some people say it's genetic. Well, over the last 100 years or so, our genes haven't changed that much as humans. You don't see a huge change in our genome. So that definitely can't explain it either. I came across this chart in my research that shows a correlation between autism and glyphosate. Glyphosate is Roundup. Has everybody heard of that? This is the most common herbicide used in the world because of its how cheap it is to use. They say that it's safe for human consumption, but they actually found that it does destroy a pathway in mice. That's not found in humans, but it is found in the gut flora of humans. So it may not be directly affecting our bodies, but it's directly affecting our gut flora. And we'll talk about later how important a good, healthy gut flora is to every neurological disorder that we're going to talk about. So you have a huge increase in the use of that. And you see the chart there is pretty crazy. You can't always say that because of a correlation there's a causative factor, but you can say that it might be contributing to the increase in autism. There's also poor nutrition, and a lot of these children, they have very, very picky diets, and so they have texture issues, and it's hard to get the right nutrients into them. I understand that. So that does contribute to the dietary factors. Poor gut health, like I talked about, the gut flora and the health of that, and then environmental toxins. children in America are exposed to, I think, about 3,000 different chemical toxins. And that's just from pesticides, from the things that they manufacture houses with. It's from all different things, but pollutants in the air. So they're exposed to all of these chemical toxins just from, even from in the womb, because the mother's ingesting things and she's breathing things. So, I mean, literally from conception, they're being exposed to chemicals. All right, has everybody heard of this documentary? I just wanted to show a short clip.
My phone rings, and it's Dr. William Thompson.
You and I don't know each other very well. You have a son with autism, and I have great shame now.
There's a whistleblower from the CDC who's going to come out and say that the CDC had committed fraud on the MMR study and that they knew that vaccines were actually causing autism.
My oldest son, Ian, was walking and running after the vaccine. He was no longer able to do that.
So I called the clinic and I said, I think my child's had adverse reaction to those shots.
And then came the headbang, constant banging against anything that he could find.
Right now, I'm sitting in a very pretty position in terms of providing you a lot of information.
The first thing that Thompson did was to plot a graph. Now, there's no link between early MMR and autism. Those two lines should track together. Now, they do track together until they get to 15 months. And they separate, and they continue to separate thereafter. And they sliced and diced the data in an effort to get rid of that effect.
The relative risk of receiving an autism diagnosis was astronomical.
Wow. The CDC had known all along there was this MMR autism risk.
In the CDC's judgment, the best public policy is to continue vaccinations unchanged.
You who run our health agencies in this country, you have an obligation to make sure that these studies are complete, thorough, so that we have all the facts.
Oh my God, I cannot believe we did what we did. But we did.
Omission of crucial data, destruction of documents, misleading the Congress, grievous harm to innocent children.
Everything I've been telling my patients for the last 10 years has been based on a lie and a cover-up.
Parents should be able to count on federal agencies to tell them the truth.
In 1978, the prevalence of autism was about 1 in 15,000 children.
If we assume that things are going to continue as they have, we can predict that by 2032, 80% of the boys born will end up on the autism spectrum. Half the children, 80% of the boys.
That's a vast number of children who are being diagnosed with autism every day.
This is going to be a complete catastrophe if we just let it happen.
So I couldn't talk about autism without at least mentioning the vaccines, especially since this documentary is recently come out. I'll just let it speak for itself. They had found that the research they did was fraud. They omitted the data that showed the link and published it.
The documentary about vaccines has Robert De Niro at the center of a big screen backlash. But late tonight, there we go.
Alrighty. So I have one more quick video. Danielle actually told me about this on the Today Show about a week ago. and it was talking about prescription drugs for ADHD and how doctors are recently, over the last couple of years, prescribing antipsychotics that aren't approved for use in children and the devastating effects it has on these children. So I'm just going to play that video really quick.
First, you get hit by psoriasis. And then you get hit again by joint pain. It's a double whammy. It could be psoriatic arthritis. Take the symptom quiz at doubleWhammy.com and talk to your rheumatologist. Now, a warning for parents. So many families are familiar with the difficult decisions involved in giving prescription drugs to children.
That's right, millions of kids take psychiatric drugs, often for things as routine as ADHD, but how much do doctors really know about them? National correspondent Kate Snow is here with more. Kate, good morning.
Good morning, Savannah. And Matt, we're talking about powerful brain-altering drugs known as atypical antipsychotics. 6 times as many prescriptions for these drugs are being written for kids now versus 15 years ago. The FDA has approved them for adults or kids with severe conditions, but most kids get prescriptions for other unapproved uses like ADHD, aggression, even eating disorders, and one man wants it to stop. Every year, 1 in 85 kids will take an antipsychotic medication. In 2014, that added up to 6 million prescriptions, and some of those kids were younger than 2. Stephen Francesco says it's all too much. Are you saying they're experimenting on kids?
Absolutely, absolutely.
Stephen has worked in the world of big pharma for more than 30 years, but he says his expertise comes from something much more personal, much more painful.
What'd I do?
He did not have a mean bone in his body. He was very loving and could also be very scary.
Stephen's son Andrew was first diagnosed with ADHD in kindergarten. As loving and energetic as he could be, he could also be disruptive and full of rage. Desperate to help him, Andrew's parents took him to doctor after doctor who put him on a series of different drugs. Did you know those drugs? As a parent, have you heard of them?
This is a whole sector that I knew nothing about and I trusted.
When he was 14, his doctors gave him a new diagnosis, OCD and Tourette syndrome, and a new drug, something called an antipsychotic. But then the unimaginable happened. Andrew died suddenly from an extremely rare side effect of taking antipsychotics called neuroleptic malignant syndrome. Even though it was listed on the drug's label, Stephen said he'd never heard of it before. When you think about it now, what do you feel?
It's it comes in a pulse. It's like a wave of incredible emptiness.
There was anger, too. At that time, the FDA had not approved the antipsychotic Andrew was taking for use in kids.
Andrew was, in a sense, the guinea pig. They were testing whether this drug would work on him.
But the doctors are allowed to do that. It's so-called off-label. They go off what the label says and guess that it might help Andrew.
That's correct.
Turns out the vast majority of kids get antipsychotics off-label. Is it safe?
Well, there are some safety concerns with these medications. We know less about the effects of these drugs on the developing brain.
Leading researcher Dr. Mark Olson says only limited clinical trials have been done to see if antipsychotics are safe and effective for kids for these off-label uses.
You need far more studies that are looking at the effectiveness and safety of these drugs as they're actually being used in the community.
Nearly everyone we spoke to for our report, from doctors to the FDA to the drug industry, agrees we need more data.
The side effects of these drugs, the power of these drugs, there's no long-term studies, and that's a shame. And that should be a priority in this country.
The FDA declined to talk to us on camera, but one former FDA official says off-label prescriptions, including antipsychotics for kids, can be helpful, even life-saving. Stephen wants more information out there, though, despite the fact that they help some kids.
Because parents are out there at sea so many times.
That's how he felt. That's certainly how he felt.
Thank you. By the way, you can find out more about this story on this Sunday's On Assignment. It airs at 7, 6 Central, right here on NBC.
First, you get hit.
So I mainly wanted to show those two videos I want parents to understand that there might be a better way. And that's my passion for doing this workshop and for being a chiropractor. I want parents to first try natural methods before jumping to prescription medication, because they do have serious consequences and side effects, and a lot of times they don't know how they're affecting children's brains because they are developing. And a child's brain is different from child to child. You can't prescribe the same thing to different children and know exactly how they're going to react in every child, because we're all different and they don't know. So, ADHD is a brain disorder marked by an ongoing pattern of inattention and/or hyperactivity, impulsivity that interferes with functioning or development. The CDC reports that 1 out of 9 children have been diagnosed. ADHD medications are the most commonly prescribed drugs for children. Doctors in the U.S. prescribe more drugs for ADHD than the rest of the world combined. Doctors write an estimated 20 million prescriptions for Ritalin alone every year. Typical medical treatment for ADHD is going to be a amphetamine like Ritalin or Adderall, and these have side effects, and they have different things that could happen with the children taking them: hypertension, palpitations, irregular heartbeat, and cardiovascular disease, gastrointestinal issues, loss of appetite, stomach pain and vomiting, aggression, dizziness, restlessness, insomnia, hallucinations, hyperesthesia, numbness and tingling in extremities indicating nerve damage, muscle twitches, sweating, and weight loss. And if they are prescribing these drugs to children under a certain age, they're not able to express some of these discomforts that they're having. So, this book by Dr. Robert Malillo is it's a great book. He proposes that all of these different disorders, like autism, ADHD, and dyslexia, are all kind of grouped together into one disorder where you have an imbalance in the size of the brain. And he calls it functional disconnect syndrome. They're basically, as a child is developing and growing, one side of the brain is not getting the correct input and the correct stimulation for it to grow at the same rate. For the brain to grow, because as you know, a baby is born and the baby doesn't have a fully developed brain. So it relies on stimulation, oxygen, and nutrients to continue to develop that brain and to continue to grow. So he proposes that there is this functional disconnect syndrome, whereas when a baby is born and it goes through the first couple years of life, at some point a part of the brain isn't getting stimulated as much as the other. So you have this disconnect where one side of the brain is firing more and working harder than the other, and so you see these disorders come about. And this book is like, I think, $10 on Amazon. It's got a lot of good information. I wanted to cover a lot more from it, but I didn't have a whole lot of time. So the symptoms of functional disconnect syndrome are poor body awareness, poor gross and fine motor skills, persistence of primitive reflexes, and we'll go over what those are later, poor eye coordination, poor social skills, and abnormal emotional reactions, a sensitive sensory system. That's like children that have autism usually don't like sounds, and they don't like different sensory input. They get very overstimulated. Compromised immune system. You can have a child that has an overactive immune system, and they have things like autoimmune type symptoms, or you can have an underactive immune system where you have that you see that they're sick a lot. They seem to really always be sick, and they can't quite fight colds off and things like that, as well as other children. Rapid heartbeat and immature digestion, food sensitivities, leaky gut syndrome, academic struggles, and poor cognitive awareness. And we'll go over leaky gut syndrome a little bit more in detail. So these are the things that we're going to kind of go over tonight, things that you can do to help a child that's not medication. So we can look for a brain imbalance and work to balance the side of the brain that might not be firing as much as it should be. Check for uninhibited primitive reflex and then work to extinguish those. Have your child's spine checked by a chiropractor. daily exercise that crosses the midline to help the brain communicate better. We'll go over those in more detail. Elimination diet, then gut healing diet, proper supplementation, and limited screen time. And I put that in there because you don't want a child with ADHD or autism, or anybody really, I try to limit my own kids to have a ton of time on TV or computer or iPad because they're not getting that brain stimulation that they need for proper development. So, I have a checklist. This is just a brief excerpt from this book I was talking about, and you can read over the different, characteristics, and you put a check if it describes your child. And so you go through this entire checklist, and you put a check. If it doesn't describe your child, just skip it. And then at the end, you're going to add up all of the checks, and it's going to kind of give you an idea of, is there a left brain weakness or a right brain weakness? And the book goes over a lot more exercises and tests you can do to see exactly where the weakness is, but I did not have enough time to go through every single one. But it's looking at things like the hearing on each side and the pupillary light reaction on each side and seeing if there's a difference. And it goes over all these different things that you can do at home to see where that child might have a problem. So, there's that. So, right brain children, these are children that have, their right brains are overactive, or at a normal level, the left brain is underactive. They are typically children with, they're imaginative and social, but they may struggle academically in a traditional classroom environment. And a lot of people know that the right brain is our creative brain. So they would rather be shown rather than they're told how to do a task. They solve problems by looking at similarities and patterns. They draw rather than write. They physically handle objects. They answer open-ended questions rather than multiple choice tests. Discuss topics and assimilate whole chunks of information rather than break them down into discrete facts. So they're more of a conceptual type learner. And then left brain children are typically, they perform well academically, but they may struggle socially and behaviorally. Children with left brain characteristics normally excel at science, details, memorization, setting goals, reading, directions, and math. And these are all the characteristics of the left side of the brain, and that's what the left side of the brain is handling in everybody. So the idea of this book is there's a deficiency in one side or the other, and you do these exercises to stimulate the side that's deficient. Because we know now that the brain is plastic and the brain can change, but especially in children, you can change the makeup of the brain just by sensory input. So here are just, these are sensory motor activities for stimulating the right brain. You have the spell game, and that's laid out in the book on 157, the musical brain balance, and the one foot in front of the other. And these are also on his website if you wanted to reference that.
So would you do these for a child who is very creative or very academic?
So you're doing this to the academic child to stimulate their right brain. And there's actually more exercises in here. Like I said, I just don't have a whole lot of time to go over every single thing. I tried, and then I had like 50 slides, and I was like, probably don't have enough time. And I was only like halfway done. So definitely pick up this book. It's really interesting. So these are the sensory motor activities for the right brain, and then the sensory motor activities in the left brain. They're all the same, but you're going to be doing them a little bit differently to incorporate the things that the left brain is going to pick up on.
Why did the different smells?
Because your brain interprets smells differently on each side of the brain.
So lavender goes in your left.
It's the same thing as And then you have some right brain cognitive skills. These are different activities that you can do to stimulate the cognitive portion of the right brain. comprehension exercises, and eye movement exercises. The eyes are actually basically a window into your nervous system, and you can stimulate different eye motions, and it directly stimulates your brain. So you can look at things like saccades and things like that to help stimulate different parts of the brain. So those are laid out in the book in more detail. And then you have the left brain, cognitive skills. And these are going to be the same, but you do them just a little bit differently. Comprehension exercises and eye movement exercise. So, like I said before, we were going to go over primitive reflexes. Does anybody know what those are?
Grasping. Like grasping?
Mm-hmm. Yep. The one right there is called the palmar grasp. Everybody loves how newborn babies just love to hold their finger, and it's a reflex. It's actually, they were born with that reflex. When they feel that sensory input, they squeeze their hand shut. And we actually have a lot of these primitive reflexes when we're born. Primitive reflexes are reflex actions originating in the central nervous system that are exhibited by normal infants but not neurologically intact adults in response to a particular stimuli. Like I said, the stimuli would be touching their hand, and they squeeze your finger. These reflexes are absent due to the development of the frontal lobes as the child transitions normally into child development. So you're born with them, but in a normal situation, you're going to inhibit them as you grow. You should inhibit them as you grow, because it would be kind of weird if every time I felt stimulus on my hand, I squeezed it. You have to shed these primitive reflexes, and there's a lot of them. As the brain gets larger and more connections form, higher levels of the brain function are ready to come into play. These new connections eventually inhibit the more primitive baby movements, setting the stage for more complex motor reflexes known as postural reflexes. Postural reflexes allow both sides of the body to move in perfect synchrony and cooperation. So an example of a postural reflex is if you have somebody standing here and you bump them, they're automatically going to kind of jump to correct themselves and to equalize before they fall. So those are the postural reflexes that we still have. If a child does not move enough to stimulate genes to build the brain, the reflexes will not be inhibited. If primitive reflexes aren't inhibited, the brain doesn't build in an orderly fashion. So these are actually commonly found in children with autism and ADHD. They have these retained primitive reflexes. And this is a chart just naming a couple of the reflexes, the purpose of it in infant, when it should kind of disappear by, and then what it can look like if they still have that reflex. And you can see some of these signs are symptoms of things like autism, the hypersensitivity, hyperreactivity, things like that. So here are some of the reflexes. You have the acoustic blink reflex. That's if an infant hears a loud noise, they're going to blink. And that's the same thing with a light stimulus. If you shine a light in their eye, they're going to blink. The otolith writing reflex is if you tilt a baby from side to side, they're going to move their head in response and try to keep their eyes horizontal. You have asymmetric neck reflex. If you turn a baby's head one way, he's gonna kind of do this thing. And they're just born with it. Our bodies are intelligent. The most important probably is going to be the rooting and suckling reflex. The rooting reflex, they feel the stimulus, and that's how they know to nurse. From day one, you have the baby that it roots and then suckles. And you can have actually pubertal problems with having these reflexes in place. We're not covering that tonight. And then you have this one called the startling reflex. I'm sure a lot of you mamas have seen this one before. If you sit down too fast or anything while you're holding the baby and they flail their arms out and act like they're scared to death. I used to feel so bad when I did that to my kids. But it's a reflex they're born with. And then the gallant reflex is one we commonly see, and that's important for chiropractors because we're dealing with the spine. If you stroke a baby on each side of the spine, say you stroke this side of the spine, they're going to turn in response. So good are in place for helping the baby through the birth canal. So they feel a stimulus and they're going to, do these things to get through and to be born. And then they have these things to help them feed and to help them develop properly. So if you see these retained primitive reflexes, say you have a child or a toddler and you stroke their mouth and they still have that, it won't be the same. You won't have the kid won't turn their head. But say you have a child and you stroke their mouth and they kind of twitch. If you have these reflexes, the way to inhibit them is to basically do it over and over and over until their body tires out and you don't see these reflexes anymore. So you bring on the reflex as described below and repeat it until it fatigues. You repeat in a rapid succession 5 to 10 times until you can no longer bring it on. At this point, stop, and a few hours later, go back and check it again. And do this several times a day until you see that the reflex is gone. And there's also exercises you can do in the book to help extinguish the primitive reflexes. You can actually go on YouTube and type in extinguishing primitive reflexes or retained primitive reflexes. And there's video after video showing you how to do these exercises with your children to help get rid of these primitive reflexes if they still have them. So, chiropractic care. Chiropractic care is not just for back pain and headaches. So, the subluxation is what we work with as chiropractors. It is described as a slightly displaced vertebrae which press against nerves, causing impingements and the result of being too much or not enough functioning. So, the disafferentation model probably best describes how chiropractic care can help with children with autism or ADHD. You have these little tiny muscles in your body, and they're postural muscles. And these postural muscles are constantly sending input to your brain all day, every day. And they're telling your body, they're telling your brain where you are in space. So you close your eyes, and say you close your eyes, and I come up to you and I lift up your arm. You still know which way your arm went, and if I'm holding it there, you can probably, within a moment, you know where it is in space, even when you're not looking at it. So these postural muscles are important to help your body with what is called proprioception. So what chiropractic care does for proprioception is if you have what we call subluxation or a vertebral segment out of place, these muscles can stretch or lengthen, and you can actually, with subluxation or anything wrong with your spine, your body will reset the postural muscles wrongly, if that makes sense. So chiropractic adjustment, you go in and you fix that, and then you're sending that proper information back up to the spine. So basically you have what's called joint position sense improved because of chiropractic care. So you have these children that have difficulty knowing where they are in space, and you help send the correct information up through their spine to their brain, and they can kind of better feel out where they are in space, if that makes any sense. So basically, the disafferentation model says that if your bones or joints are out of place, your body, your brain is getting incorrect information, or what we call aberrant information, to for proprioception or for knowing where you are in space. And that chiropractic care really helps reset those muscle spindles and helps children with their proprioception. Okay. Children with ASD typically have poor proprioception. They cannot feel where their body is in space. I don't know if anybody has much experience with different therapies that they use in autism, but this is exactly why therapies like compression works well, because if you feel like your body is just, you can't feel where it is, when you have something compressing on it, you feel relief for a minute. You feel like, okay, there's my arm, there's my arm. You know what I mean? You feel where you are in space, and it's extremely important. There was a case series with 8 children, and they had symptoms of autism or ADHD. They got chiropractic care, and they worked to inhibit the primitive reflexes. 7 out of 8 pediatric patients showed drastic improvement in behavior. So here is kind of what I was talking about. you have a subluxation, then you have altered afferent input to the brain. That means the input to the brain is incorrect, basically. You're sending your brain information that's not quite right. And then you have altered somatosensory processing, altered sensory motor integration, altered motor control, and then altered function. And then on the flip side, you have an adjustment. You have appropriate joint movement because you're resetting those muscle spindles. You're giving your brain normal afferent input. You're getting appropriate somatosensory processing, appropriate sensory motor integration, accurate motor control, and then good function. So here are a couple of case studies I found. These are the authors of good results with chiropractic care in children with autism or ADHD. There's actually a lot more than this. I just found these in just one quick search. This was a case study with a 5-year-old boy, and he presented to a chiropractic office. This is a good one because this is kind of like what we do in our office. We are looking at structural components of the spine and comparing them to a normal model. And we want to get you from maybe what looks like this to what looks like this. In this case, he was a 5-year-old boy, and this was his cervical spine when he first started care. And he has a kyphotic posture, which means your cervical spine should be shaped like a C, just like this, for proper flow of CSF or proper function of your spine. And in his case, he had a reversal, which is extremely common. A lot of people have reversals, and we see it every day here. So he had, I think, he had several adjustments a week, and after, I think, 35 adjustments, they saw that he went from kyphotic to a lordotic posture, which is normal. This is what you want to see. If you have a proper curve in your spine here, you have proper CSF flow to the brain, and you have proper function. So through the restoration of normal biomechanical structure and curvature, these abnormal stresses and strains were removed from the cord, which led to improvement in function. So in his case, he did have that kyphotic posture in his neck. They improved it, and he had elimination of symptoms. His doctor completely stopped recommending Ritalin, and he had really good results. Midline exercises. I told you to go over these a little bit more. These are basically exercises that cross the midline. So that's going to be, if you draw a line from here to here, that's your midline. And if you see a child that, if he's trying to reach across and then switches hands, you want to definitely do these exercises with him, because it's going to help him or her do these exercises on the other side of the body, basically. The figure eight was popular in helping children learn to use their arms on each side of their body. And you see a lot of children have improvement in reading, because if you track words on a page, you have to be able to flow through the midline. So these are different. I just got them offline, just like the other exercises. You can get on YouTube and type in midline exercises, and occupational therapists use them to help integrate the right and left brain. Dietary changes. So there's been research that says that the gut and the brain are connected. Has everybody heard that? So the gut-brain axis is the reason why nutrition and supplementation is so important for neurodevelopmental disorders. Digestive tract health directly influences the nervous system. The early use of antibiotics and repeated exposure to allergens damages the gut lining, and that leads to an inflammatory response. Eat organic produce to avoid harmful pesticides, because evidence has suggested a strong relationship between pesticide exposure and autism spectrum disorder. And then there's the elimination of gluten, casein, and dairy, in addition to known allergens. The gluten, casein, and dairy-free diet is a popular one for children with autism spectrum disorder or ADHD. They actually found that the gut flora helps us detoxify heavy metals. So that's another really big reason why it's important.
Now with like the gluten and casein, like what my daughter, she's autistic, and I tried that before I even went to her pediatrician. Then her pediatrician turned around and said that that's only effective with kids with autism if they have a leaky gut. But I've also heard that it's also just all around better for them with that.
And normally when you have children with autism, they do have a leaky gut because a lot of children with autism have gut issues. You know what I mean?
Yeah, she doesn't. I don't know if I've experienced that. But her doctor said she doesn't, but I've been like contemplating going back on the gluten and casein foods to see if it, if something does click.
Right. And there's medical doctors that will say it doesn't help, but my thing with all of this, chiropractic care, diet changes, it's still safer than any medication. To change the diet, it might be tough, and I know it's tough, especially for children with autism or ADHD because they have all of these picky habits. But it's definitely a good try at least. It doesn't hurt anything at least. But it is in relation to leaky gut, and if they have any kind of allergies, these are the most common. This is just like you're talking about leaky gut. This is just a picture to kind of explain what's going on with leaky gut syndrome. Has everybody heard of that? I know it's really popular right now. In your mucosa of your stomach, this is your gut lining, your intestinal lining, not stomach. You should have these tight junctions. And then when you have exposure to, like I talked about, the medication exposure and the allergy exposure, you see the junctions are destroyed and large particles can get into your bloodstream. And this causes the inflammatory reaction through that. Okay, so this is Dr. Axe's just 4 steps to help heal a leaky gut. He recommends that you remove damaging foods first. That's going to be the things like the pesticides and the GMOs and the allergens and things like that, the things that are known to harm our intestines. And you replace with healing foods, and we'll go over a couple of those in a minute. You repair with supplements. So you supplement with things that are going to help repair the intestinal lining, because the body is smart and the body does heal itself. So you work with the body to help heal that, and you rebalance with probiotics. Because not only with these different things do you have the intestinal lining being destroyed, you have the good gut flora being destroyed, like the Roundup and the pesticides and the GMOs destroy the good gut flora and the antibiotics. So you want to avoid, this is Dr. Axe's recommendations, avoid gluten, cow's dairy, sugar, unsprouted grains, and GMOs. This is just to widen up how you heal your gut. The food list that's good is bone broth, raw cultured dairy, fermented vegetables, steamed vegetables, healthy fats, and fruit. So proper supplementation is important because there is evidence that suggests fatty acid deficiencies correlates with neurodevelopmental childhood disorders. And the brain itself is made up of phospholipids, so it's extremely important from birth on to help these children develop their brain by giving them these omega-3s and DHA that they need. And we do pass it on through breast milk, so that's their early exposure. In mouse models, an altered gastrointestinal microbial composition was linked to animals displaying autism-like features. Furthermore, administering probiotic treatments were seen to improve these particular behaviors, hinting at a possible therapeutic avenue. So this is like we're talking about supplementation with probiotics to help heal and to help replenish the good gut flora. One of the most common epigenetic mechanisms, DNA methylation, is now thought to be an important player in ASD etiology. And the names in parentheses is the research, and I have all of those papers here if anybody wants to see them afterward. So DNA methylation is a process that we do in our body, and it's adding a methyl group to help detox. And that's, we can supplement with the methyl group, and that's this is a methylation donor. So that's an option for a supplement. There are some indications that early exposure to inadequate vitamin D may interact with other factors and contribute to the etiology of autism. Low vitamin D status might be highly prevalent in populations with ASD, and intervention with vitamin D might be beneficial in reducing autism symptoms among those who have ASD. So the low vitamin D might just be because children with autism might not want to play outside as much. So you might need a supplement just because they're not outside as much. But it's definitely important because there has been studies showing that there is a lower level of vitamin D in these children. So here is a good list to start with of supplements for children with autism and ADHD. And these things are to help heal the gut. Omega-3, probiotic, a methyl donor, vitamin D3, digestive enzymes, glutamine, and quercetin. Quercetin is in our DHIST, and there was a study I read that was saying that quercetin helps heal those gap junctions in the gut. So, I couldn't go over GMOs and pesticides as much as I wanted, but I would encourage you to do your own research, and documentaries are a good way to do that. I watched Food Inc. several times, and it's got good information on how to avoid GMOs and just where they came from, what are they, and different ways to help avoid them. And these are a couple of the ones I found. Seeds of Death, Fed Up, Bite Size, and Food Matters. And then I found this and really laughed. Because it's true, the only people that are saying that the GMOs are safe are paid by Monsanto. And of course, they're going to say that because they're making it. And they're making a huge profit on it. So here is your take-home plan. Chiropractic. Have your child's spine checked by a professional in case there is things like a kyphotic curve in the cervical spine or different things. You can have children with hypertonicity of muscles on one side, and chiropractic care really helps to balance that. And also, when I was talking about stimulating a side of the brain or the other, a lot of, 90% of the input to the brain is from the spine. And so you give a chiropractic adjustment, you're stimulating directly to the brain. And that helps grow those different sides. You can use the checklist. Were you asking about the checklist? No. So you can use the checklist and figure out where there's an imbalance and do different exercises to stimulate that. And then you can work on inhibiting the primitive reflexes. If you find there's a retained primitive reflex, work on inhibiting that with the different exercises, or you can just stimulate until you see that it's gone. If you need any help with that, I can show you. If you need help with that, eliciting, I can show you. Work on strengthening the weak hemisphere. I think I already said that. Diet changes, gluten, casein, and dairy-free. Proper supplementation. And I will add, anything that you buy tonight is 15% off. If you want to go ahead and pick up a couple of supplements, you get a discount just for being here tonight. Exercise. Exercise is great stimulation for the brain and great stimulation to help the developing of the brain. Limited screen time. We already talked about that briefly. And chemical-free cleaning supplies. You want to eliminate as much as you can the exposure to chemicals in your house. You want your house to be a safe place as much as you can. Take out the harmful chemicals the best you can. Take out the cleaning materials and use natural substances like vinegar and things like that to clean with, so they're not inhaling these particles in addition to all the other toxins we're bombarding them with.
Like air fresheners.
Yeah.
Exactly.
Yeah, especially those like clay ones.
Yeah.
Those are, those are very toxic. So,
We use no Eubanks.
do what?
So we use no Eubanks.
You can use essential oil.
Plug your seeds. Plug your air fresheners.
So, and I don't mean this to sound harsh, but the bottom line is we are bombarding our children's bodies from day one with harmful chemicals that were never intended to be detoxed in the body. Over time, our ancestors didn't have exposure to these chemicals, so we didn't have evolutionary things in place to fight these off in our liver and our kidneys. So we vaccinate soon after birth. Days after birth, they're vaccinating for hepatitis. That just always baffles me. And we formula feed with conventional formula containing pesticides. And on that note, they've actually found breastfeeding as well can pass pesticides and Roundup 280. So either way, they are getting chemical exposure. So I don't want to offend anybody just saying that about formula. Then we raise our children on a typical American diet full of sugar and void of nutrients and vaccinate regularly. We put these chemicals into a young, maturing immune system, insist to parents that they let their newborns cry it out. We introduce this solid food, the wrong solid food, too early, spend way too much time in a bouncy seat and exercisers, then wonder why we see children with neurodevelopmental disorders. Given these environmental factors, it's no wonder American children are the sickest in the world. I was talking about this with Dr. Mike before we left. We are a product of our environment. There is a genetic component to autism, and there is a genetic component to different things like this, but ultimately, we're a product of our environment. He explained it like this. You can take a healthy fish and put it into a sick, disgusting tank, and what's going to happen? It's going to get sick. But you take a sick fish and you put it into a clean, healthy tank, and that fish is generally going to get better. So our environment is extremely important to our state of health and our children's health. That's it. Any questions? Do you have any questions?
So with our with our early intervention and stuff, I was talking about putting weighted vests on, weighted blankets, the brushing and stuff. It's pretty much all similar to what you're talking about, right? Just the organs and then the brushing of the mouth and everything inside the mouth, along the gum lines.
I haven't heard of that, but the weighted blankets is definitely it's for the proprioception, so they can kind of feel where they are, where their limbs are.
Because when her therapist was there today, my daughter, we were trying to teach her how to take stickers off the sheets and then put them on another piece of paper, and she wasn't really wanting to pay attention, but then she was sitting in her beanbag chair, then our therapist kind of lifted up the beanbag chair and put a little bit of pressure on her spine, and all of a sudden my daughter's adamantly someone started looking at the paper and started concentrating more on what she was doing, and so I just kind of feel like that's kind of along the lines of what they're doing with her right now, so yeah, it makes sense.
Yeah, fine motor tasks like that are really great for developing the brain. Any more questions?